I'm Demi Dawkins. I'm one of the neurosurgery fellows here in vascular at Sims Murphy. Tonight we're joined by Sonia Eden, one of the neurosurgeons here. Welcome.
Thank you. Thank you, Demi.
So I wanted to start off with some questions about how you became a doctor. What did you want to be when you were growing up as a kid?
Oh, that's an interesting question. When I was growing up, I wanted to be, it morphed. So initially, I wanted to be a doctor. So I had a family doctor. He literally was a family doctor. His name was Dr. Albert Kuhn. And he looked like the doctor you would see on a Norman Rockwell picture. Like he had little glasses, receding hairline, and he was an older man, gray hair, and his name was Dr. Kuhn, and I loved Dr. Kuhn. So Dr. Kuhn was my doctor. He delivered me. My mom had me when she was 40, so I would have thought that was a high-risk pregnancy. Apparently not. Family doctor delivered me right at Helter Hospital. Dr. Kuhn did. Dr. Kuhn was my mom's doctor, my brother's doctor, my aunt, uncle's, cousin's doctor. Like he was literally the family doctor. And when I was really young, when I was 1 or 2 years old, I would cry, more like when I was 2. I would cry whenever we passed Dr. Kuhn's office because I wanted to visit Dr. Kuhn. So sometimes I would tell my mom, oh, I don't feel good. I have a sore throat. I'm sick. Let's go see Dr. Kuhn. And I would beg her to take me to see Dr. Kuhn. I'd be like, I need a shot. Let's go see Dr. Kuhn. Like it was unreal. So fast forward, that was when I was, 2 to 4 years old. Fast forward to when I was a teenager and preteen, needing my vaccinations or going in sick, and he tried to give me a shot. They loved giving you penicillin shots back then. Boy, I'd be kicking and prodding for him to get away from me because I didn't like needles. So it was really, my first touch point into healthcare literally was Dr. Kuhn and my experiences with him. Despite him giving me shots, he was just a very down-to-earth, good human. And I think I picked up on that. So that was my first touch point into medicine. I think my first touch point into neurosurgery came in high school when I did a term paper in my AP Bio class on neurotransmitters. And I was always kind of that weird kid who was very interested in the brain. Whenever we did any dissections in bio or in science class, I really wanted to access the brain. Like when we did the pig, I had a million questions about the brain and actually worked with the biology teacher to get the pig's brain out of the skull. And it was one of my friends who went to high school and medical school with me who recalls that and tells me, how funny it was, how intrigued I was and passionate about the brain. So I think that was my first touch point into neural networks, and then it just kind of snowballed from that, and I had more exposures and was able to do some research having to do with the brain, and then had a chance to see a brain surgery while I was doing that research, and that was it. That kind of sealed the deal for me.
Yeah, it's interesting you talk about your experiences with your own doctor and how that kind of inspired you to want to become one yourself. I hear that a lot, and for myself the same. You find a good doctor, you find someone who you want to be like, and that kind of leads you down this path. So what have you done since then to kind of try and continue to pay that forward?
Well, that's an excellent question. I think it's very important that we act as role models and mentors to youth and people coming up. I've done several things in that realm. One thing that we're doing is I'm actually with CNS, Congress of Neurological Surgery, I'm actually helping pilot a program, a mentorship program in the Detroit public school system. And if it goes well, we're mentoring sophomore students in high school in Detroit, in the Detroit public school system. And if it goes well, this is a program that the CNS may roll out nationwide, that neurosurgeons in their local communities can partner with high schools and help mentor kids. I do a lot of mentorship through my affiliation with med students when I was at Western Michigan University, and med students from Wayne State University. And now I've kind of branched out, and I have med students who are finding me from other universities that are outside of my local universities
Mhm.
and connecting with me. And I spend a lot of time mentoring them and trying to support them because I think it's important that we pay it forward and we really try to empower youth and individuals to achieve their goals. And if their goal is to become a neurosurgeon, then I'm going to do what I can to help them.
Right.
I will tell you that there was one young lady when I was at Western Michigan. No, there's one young lady when I was in practice in Kalamazoo, Michigan, and we had a med school there. It was a relatively new medical school. It opened, I think, in around 2008. WMed, Western Michigan. It's actually the Homer Stryker Western Michigan University School of Medicine.
Mouthful.
Yes, definitely. And one year there was a young lady who reached out to me and she told me she was a first year med student. She told me she was interested in neurosurgery. So organically, we grew into having a mentor-mentee relationship, and I would meet with her probably once every quarter, once every 3 months, and then we would text and email in between, and I supported her. And she was actually the first medical student to match in neurosurgery out of WMed, and she matched for residency at University of Michigan. Mm-hmm. So that was pretty gratifying. Arushi was her name, Arushi, and I still mentor her. She's still a very important part of my life and vice versa. She was from Ann Arbor and really wanted to go to Michigan for residency and ended up back. So that was quite nice.
Yeah. I mean, I agree. These mentorship opportunities are really valuable because not everyone, finds that immediate connection with their doctor. They need a different role model to reach out to. And oftentimes I do think it's by word of mouth. You have a friend of a friend who has a child who wants to be a doctor and you're put in touch. But I think your program would be incredible to make it a more organized system to help connect people with different mentors. So that's cool. All right. So we also know that you were fellowship trained in minimally invasive surgery. Why did you feel that was such an important aspect of what you wanted to do?
Well, that's an interesting question. So when I first started residency at University of Michigan, or when I was first attracted to neurosurgery, it was all about the brain. It was the neural networks, the nervous system, but more the brain. And I went into residency thinking I wanted to be a vascular neurosurgeon. Like you, Demi, okay? So that was the sexy, very kind of riveting, very extremely rewarding cases. And I loved vascular neurosurgery. But over the course of training, at some point I said, I'm not going to do a fellowship. I'm just going to go and be a general neurosurgeon. Right. I don't know when I made that shift, but I did. Until my chief year. So we had a individual who was 3 years ahead of me in residency. His name was Paul Park. And he's one of my friends, in residency. He went to Michigan for med school and did residency there as well, just like I did. And Paul came down to Sims Murphy and worked with Dr. Foley and did a minimally invasive spine fellowship with Foley. Mm-hmm. And then he took a job back at Michigan. So my chief year, he came back to Michigan. And we didn't really have anyone who was specialty trained in minimally invasive spine surgery until Dr. Park went and did that fellowship. So he came back and I had some exposure to MIS cases and I fell in love. I said, oh, this is nice. Because, some of the big scoliosis cases, that was too much work for me. That was a lot. I would need to do those with a co-surgeon for the rest of my career because they were exhausting. And, I had exposure to the MIS cases and I fell in love. And I told Paul, I said, I think I do want to do a fellowship. I think I want to do minimally invasive spine surgery. I'm not going to get enough exposure working with you during my chief year because, in your chief year, we're doing the aneurysms, we're doing the more complex cranial cases. We're doing the big deformity surgery. So that doesn't leave a lot of time for me to do MIS cases. And Paul said, well, yeah, then go to a fellowship with Foley. And I said, oh. I said, do you think I could do that? He's like, oh, yeah, I'll just give him a call. But he called. And a week later, I asked Paul, I said, so do I need to apply? What do I need to do? He's like, well, I called him. They said you can come to the fellowship. I said, are you sure? Do they need my CV? Do I need to do anything? He's like, no, I think you're good, son. They're going to call and everything will be fine. And needless to say, fast forward, a year later, I was here doing my fellowship.
Could you talk a little bit about how you think that, we could help others that are coming behind us in a similar manner?
Yes, definitely. I think, that relationship that I had with him was definitely invaluable, because I do feel that at that juncture in my life, it was almost like a fork in the road. And I could have gone in one direction, which would have been to do general neurosurgery, or I could have become fellowship trained. And it was really that network of knowing Dr. Park and Dr. Park having such a great relationship with Dr. Foley that ultimately led to me becoming an MIS spine surgeon. So I'm very, grateful for that opportunity, and grateful that things worked out that way in my career. And I think about that a lot. I do tell students that I mentor, and young residents and doctors that I mentor, that it's important to develop your network and to connect with people. I feel that that's something I could have done a better job of when I was younger. I feel that I feel I was shy now. Some people tell me they don't think I'm shy, that I maybe talk a lot. I think I was shy. And I feel that, I think that, if there's anything I could change, one thing I could change looking back is that I would have been more, what do I say? More
assertive.
Yes, I would have been more assertive and more determined to develop networks and connections. I did develop some, but I think I could have done a little better at that. So I think it's very important, because you never know where your connections are going to lead. You may connect with people who end up supporting you, advocating for you, mentoring you. You just never know what walk of life it's going to lead to.
Yeah. I mean, I'd like to echo that. I had a very similar experience to what you described. As you're going through med school, residency, fellowship, and then getting your job, you pick up people along the way who seem to have your back, who seem to give you good advice, who you feel you can trust and you value their opinion. And it's important to keep a hold of those people. Just because you leave one institution doesn't mean you need to be gone forever, because they will continue to advocate for you if they feel like they can help you. So I do think making those connections and keeping them, and being a bit assertive about reaching out to people and not feeling like you're bothering people, is really important, because I do think that we sometimes, especially as minority and even further minority women, we've been raised to be independent. We've been raised to not be troublesome. But you have to advocate for yourself just as much as you're asking people to advocate for you. So I think that's important.
So Demi, can we switch gears a little bit? Can you tell me a little bit about your experience and what attracted you to medicine and neurosurgery?
Yeah, I mean, similar to you, I didn't have this one amazing doctor that made me want to be one, but I just remember, as far as I can remember, that I've always wanted to be a doctor. And as I kind of came of age, it came down to really wanting to do something that I felt would help my community while still serving my interests. So I like science, medicine, community. It all seemed to tie together for me. And so that's how I kind of built to where I got into med school. And then I had no idea I wanted to be a neurosurgeon going into medical school. That was all a complete surprise to me. I don't think I really knew what I wanted to be for a long time, but I thought pediatrics, I thought obstetrics, I thought general surgery. And it wasn't until I actually saw a neurosurgery case and just completely fell in love with it. My personality seemed to fit my interest in what was going on and the anatomy and how we fix people, really just seemed to fit. And it really grew from there. I remember the first neurosurgery case I saw, it was an ACDF, but it was done in the middle of the night for whatever reason, because that's what we do. And I remember calling my mom the next morning, walking out of the hospital on no sleep, and telling her I just had the best night. And she was like, "You're going to be a neurosurgeon, aren't you?" And I was like, "I think I am." And that was it. Nothing else really ever struck me like that did. And then from there, going on to residency, like you said, vascular is the sexy thing.
That's right.
Mainly because it's growing so rapidly, especially on the endovascular side. We're treating more and more things that were considered not treatable. And to kind of be a part of that history of neurosurgery it's both rewarding because it's helpful to patients, but it also really keeps me intrigued about what I'm doing. So, similar experience. I did a stroke case, and I saw somebody instantly get better on the table from something I did or helped do. And it was that kind of instant reward and impact on someone that really made me want to do it. And nothing else ever hit like that since then. So, now I'm a fellow here, their first female fellow, and their first Black female fellow. So it's been an amazing ride. One thing that I want to talk about is, was there ever a point at any stage of this during school or during your training that you felt like you wanted to give up?
No. There was not a point when I felt I wanted to give up. Even during the toughest times, like the times when, I can tell you this one story. It's kind of gross, but I'm going to tell you anyways, guys. You can decide if you want to keep it. But I remember one time when I was an intern, and every once in a while, we would, interns would have vacations, and we had 3 on service. And then when one would be on vacation, you'd be on service, and there would only be 2 of you. And so during that time, we would take call every other night. And I was on pediatric surgery, and I remember I'd been on call all night, been up all night. We were routing the next day, and I felt sick. I was like, okay, something's wrong. I don't feel good. I excused myself. I went to the restroom, threw up, came back, did not mention it to anyone, and integrated right back into rounds, writing notes and orders and things of that nature. And much later, I told my co-intern that I, wasn't feeling good. But even in the toughest of times like that, or sometimes when you're up all night just tired and the days keep going, I never wanted to give up. I kept my eye on the prize, and I just knew that there was something about neurosurgery. I just knew that this is what I was meant to do.
I do feel like neurosurgery residency and training has this way of pushing you past limits that you thought you might have had. How long can you stay up? How hard can you work? How long can you stand? And it's not a punishment. It's not people trying to haze you in any way. Sometimes that's literally the demand of what we have to do. So I remember similar occasions like that where you're just pushed to your limit. But I agree. I felt like it only made me that much more stronger. I will say I had one occasion in undergrad. As you're going through this process, you're becoming a doctor. You're joining like a league of extremely smart people. And each time you get a little bit higher in the rungs of things, you're becoming just like everybody else. Like in elementary school and middle school, you were like the smartest thing in class. In high school, you were one of the 20 smartest people. Then you get to college, everybody's smart, right? Med school, everybody's extremely smart. Residency, everybody's extraordinarily smart. And that transition for me from high school to undergrad, where I was the best at everything to everybody was just as good as me, I found profoundly intimidating. And I remember being in class and not being sure of what I was supposed to do, but being afraid to ask for help, ask, questions in class in front of other people for fear that I was going to sound like I was the dumb one. And so I do think it's important to know that you're not alone in feeling that way. There are going to be times where you feel uncomfortable or unsure, less confident than you've ever been. But that everyone probably feels that way. We just don't really talk about it as much in medicine, especially.
Right. You're absolutely right. And I can remember, although I had I'm very biased, but I had what I consider to be one of the best, training experiences I could have any place in Michigan. I absolutely loved Michigan. I love Michigan neurosurgery. I loved all my attendings. I felt very well supported. But sometimes walking around there, I was the first African-American female woman to train at Michigan and do neurosurgery. And the program's been in existence for a very long time, practically since the advent of neurosurgery. And there were certainly times when I walked around as a neurosurgery resident and I would doubt myself and wonder, like, am I good enough to be here? I mean, there's no one else here that looks like me. Is this where I'm supposed to be? But, by the grace of God, I had very good people training me. None of them looked like me, but they were all extremely supportive of me. And that made a huge difference. Yeah. Demi, have you ever wanted to give up? Have you ever felt like you wanted to give up in training or neurosurgery? I know you talked about the undergrad experience. Have you ever had that feeling in any other time or juncture?
I mean, to be honest, that experience in underground was kind of like the foundation for everything that was to come. I almost gave up then. I majored in chemistry at Ohio State. I wanted to be just like my dad. He's a chemist. And so I was like, I loved chemistry in school. My dad was a chemist. This is like in my blood. It's going to be great. I had all these, prereqs, so they placed me in some really advanced classes. And my first day, I just, like I said, was so intimidated. And I remember calling my dad and saying, I don't think I can do this. I don't think I can do chemistry. I never got to the point where it's like, I think I need to drop out of school. But I thought about changing my major, changing my plans, because I was like, maybe I'm not as good at science as I thought I was. Maybe I'm just not as talented as I thought I was. But I think it was more of an intimidation. I was at one of the largest schools in the country and classes full of like 300, 400 people. And that was scary to me. It was foreign to me. And getting past that was probably the most important point in my life, because every time I was ever felt with that uncomfortable feeling again, I never felt like I was going to quit. I just knew it was that one thing that I was going to have to get over. But it wasn't the only time I felt like that. I had the similar feelings that you described in residency. I was also the first Black female to graduate from our neurosurgery program in Wisconsin. And again, nobody who looked like me. Thankfully, we had a lot of women that I trained with, and that's always helpful. But you start to doubt yourself, whether you belong there, whether you're doing as good as everyone else. And those doubts never turned to me wanting to quit, but it definitely eats away at a little bit of your self-confidence. And I think it's just important to kind of move past it, not let it scare you out of doing what you obviously very much want to do.
Right. I mean, I think it's important for us to find ways to really dig deep and still believe in yourself and be empowered, because once you move past it, you really feel like, there's nothing that's insurmountable for you.
Right. You look back at those things and you're like, that little kid was so scared of something that was not that important or dramatic now looking back. But what do you think is the hardest thing about practicing medicine? And
I think that one of the hardest things for me about practicing medicine is the inequities, the injustices that we see. I mean, if I can be completely frank,
you can.
COVID, I mean, COVID has really brought to light for a lot of individuals some of the inequities we have from, healthcare perspective, from access to food, housing, transportation, healthy, what did I say? Food, housing, transportation, quality health care. There are significant inequities here. Personally, I feel that there, has been a pandemic that preceded COVID-19 of poverty and racism in this country. COVID-19 kind of put it in the forefront for a lot of individuals. But I think that's one of the most difficult and daunting things for me is the inequities that we read about on a day-to-day basis in healthcare and in healthcare delivery. And I really want all patients in the U.S. to have access to great quality care, and I don't want anyone to be left behind.
Because that's what they deserve,
Absolutely. Absolutely. We used to always, healthcare is a right or, what is it, that phrase? It's a right, not a privilege.
Yeah.
Right? Yeah, so I'm way on the healthcare is a right side as opposed to being a privilege.
Yeah. I think personally for myself, what I've seen come to light more is the mistrust of the medical community and the Black community. And, our history with medicine in this country is not great. So it's hard to blame people for their skepticism or their doubt of their doctors. What do you think we can do to help fix that,
Oof, yeah. I mean, I agree. I mean, with what happened with Henrietta Lacks and with the Tuskegee Airmen, I mean, certainly people, African Americans, have a reason to have a mistrust of the medical system. But it is worrisome, as you said, especially when you see that there are African American patients in this country who don't even trust us, African American physicians.
100% true.
Yeah, I mean, I can give you an example. I mean, I think that social media has become extremely powerful, and people are reading and buying into a lot of things that they're seeing on social media, a lot of them which don't have any sort of medical basis or background. And I certainly don't know how we can overcome that. Some folks, their heels are dug into the ground, they're drawing lines in the sand, and they're not actually interested in looking at the evidence and evidence-based medicine.
There you go. My family members will call me as one of the only doctors in my immediate family, to double check the medical advice they get in the person that they've been seeing as their doctor for decades. I have an example. My uncle was diagnosed with prostate cancer, and he wasn't sure if he wanted to undergo the treatment being recommended to him because he just didn't trust his doctor. And he calls me to ask my opinion on it. And, we're neurosurgeons. We do not treat prostates.
Right.
But, I have to with the best that I can do and find people to look over his case, make him feel more comfortable with that decision. Ultimately, he did undergo treatment, and thankfully he did and is doing well. But not everybody has a doctor in the family that they trust, that they feel like they can go to, and which I think speaks to why it's so important for us to have more people of color in medicine in all different levels and roles, because I don't know what it's like for you, but when I have a patient who looks like me and I walk in the room, I feel this immediate sense of either pride that they see a Black doctor, or just comfort that they seem like they trust you and believe you a bit more than when I see them talk to some of my other colleagues. I don't know if you've had this similar experience.
Definitely. I've definitely had similar experiences in Detroit. When I would walk into the room and patients didn't know, what I was going to look like. And oh my gosh, they would be like, I mean, a lot of times they say, oh my God, I'm so happy. I'm so happy to see a Black doctor. Or they would be like, you go, girl. Yeah, I'm so proud of you. So it was always one of those two dialogues. And I agree. I think it's uber important for us to have doctors who represent the patients. We need to be more representative and more diverse in healthcare delivery.
So, you were the first Black female neurosurgeon to be hired here at Sims Murphy. How does that feel to you?
That's a great question. It feels great. I mean, it feels amazing. Sims Murphy is a very large group, of physicians, all dedicated to the neural service line. But it feels great. I mean, I will tell you, back when I trained here as a fellow back in 2007, although I was, grateful for the opportunity to work with Dr. Foley, I was a little apprehensive about moving to the South and to Memphis. I said, oh, what's that going to be like? But everyone was very nice and friendly and supportive when I was here. And so fast forward now, I'm very happy to be a part of the team and a part of the organization as an attending.
You've already made several firsts so far in your life, but what do you think your overall legacy will be?
I've never actually thought about my overall legacy. I would hope that my overall legacy would be always putting patients first, so patient care first, delivering excellent quality care, and really being an advocate for my patients and for eliminating health inequities. I hope that will be my legacy, part of it, at least. Maybe, yeah. Maybe improving my snowboarding and becoming a professional snowboarder on the side or something, but who knows?
I'm sure you make some firsts in that community too. So what do you think about the world of neurosurgery now versus where it was when you were in training? How do you think it's changed?
Oh, wow. I think it's changed a lot. I think that one of the reasons that I was attracted to neurosurgery is that there are so many things about the brain or the nervous system that we don't know and that we're still discovering, and that I figured that there would always be new treatments and innovation in this field. I feel that there's kind of a new buzz. I know there's a new buzz in neurosurgery in the sense that I feel that there is at least a new interest in looking at diversity and equity and initiatives within neurosurgery. I do feel that buzz. I think that is an exciting thing. Certainly, I feel that organized neurosurgery in and of itself still is not very diverse, but the fact that there are initiatives moving forward to try to increase the diversity is very promising and exciting to me.
Yeah. I also feel like, neurosurgery is one of the younger surgical subspecialties. which is why we have so much innovation. You know, we're still trying to grow and figure ourselves out to a certain extent. But I also think it extends into other things, like what you were saying, being more open minded about diversity initiatives, being more open minded about how we can improve teaching and the training experience, which, you know, being still in my training is really important. You know, when I was in training in Wisconsin, and even since being a fellow here, in both places, there's this continuous conversation about how can we teach our residents or fellows better. How can you individualize and tailor that teaching process? Because you are teaching people to operate on brains and spinal cords, and these are people's real actual lives. And I think for me, over the 7 years when I was in Wisconsin, I feel like that training experience has improved. I don't know if it's just me, but I do think there's been more tailored to constructive criticism and feedback, and not just a focus on continued labor. So I found that that's been something that I think is a good change, a good improvement. A focus on educating and training better surgeons is a dedication to improving the way we take care of patients. So
I agree. I agree 100%.
as you've said multiple times, you know, health equity is really important for you. How did that come about to be such a big passion of yours?
Health equity is a term that's used right now in medicine and epidemiology, healthcare space, and what it describes is giving all patients equal access. Well, let me take that back. What it describes is giving all patients access to the same quality care. So it's not necessarily giving all patients equal access, but say if one patient has a metabolic disorder and needs extra care, to be made whole because of that, then that patient gets that extra care. So everyone's given all the care they need to have healthy, equitable lives and healthy lives and outcomes. And that's really what health equity is. I became interested in health equity or healthcare disparities back during my residency at Michigan. I think I read some articles. I was reading some articles, some publications. They were not neurosurgery publications at the time, but just regular medicine publications that were talking about differences in outcomes of patients diagnosed with colon cancer, prostate cancer, and differences in care that patients receive with coronary artery disease. And that really piqued my interest, and it bothered me that, because you were born with less money or less resources or with a certain color of your skin, that you had to deal with these challenges here in the United States. So we had a year and a half of research lab time at University of Michigan, and I applied for a fellowship through the Kellogg Foundation. It was a Kellogg Fellowship in Healthcare Disparities, and it was a postdoc fellowship. And I remember I was an MD applying for this postdoctoral fellowship, which is what typically PhD students do when they finish their PhD before getting a job in the real world. So in a sense, it was a long shot for me to get this, but I was very passionate, and I just moved forward, and I just knew in my heart of heart that was what I needed to do, and I applied, and I got the position, and I did this Kellogg Fellowship in healthcare disparities for a year, and for the other 6 months, I continued to do my healthcare disparity work, and I just have always found that to be something that's very important to me. It's very important to me for everyone to have access to the care that they deserve and need.
I mean, I think it's really inspiring that you identified something that bothered you, that you were passionate about learning about it and then trying to fix it and going through all of these things, which take time, and it's not part of your definition of being a neurosurgeon, but it felt that important to you that you want to change something about it. So thank you for doing the work that you're doing.
Oh, thank you. It's my pleasure. I can tell you it's very daunting work. It's a daunting task. And sometimes I feel very overwhelmed when I'm thinking about, my path going forward and what the next step is of what I want to learn about or try to improve, because there are so many sectors that we really need to get involved in order to really implement interventions that are going to be impactful and make a difference.
There have been several studies, like you mentioned, about racial bias and treatment of Black patients specifically. What has been your personal experience with this? Have you witnessed any of this firsthand, and how have you dealt with it?
I can give, yes, I have seen some things that were quite disturbing in my own family. For example, I have a cousin, and she was going through some significant challenges with kidney stones and had to have a stent put in and different things, and was in an exorbitant amount of pain from these stents they put in. And I remember she was trying to get help for her pain from her own doctor in California, from the urologist and even her primary care physician. And I remember how much of a challenge that was for her. And there was this notion that, that they were kind of writing her off and writing off her pain. Everything changed, though, when she mentioned that her cousin was a neurosurgeon and would they be interested in speaking to me. And all of a sudden, all she did was mention that, and then they didn't even speak to me, but they prescribed her some pain meds to help with her pain. Like, it was quite odd to me. So, there are certainly studies out there showing that African Americans, there's a perception that African Americans may experience pain differently or feel pain differently, or, and there are studies out there showing that physicians may buy into some of these biases, whether it's subconsciously or consciously, in the sense that there are studies that are showing that African Americans who present to the emergency room in pain are oftentimes less likely to be prescribed pain medications than non-Hispanic whites. So seeing that in my own family, was a little bit telltale.
So you have one patient in pain that looks one way, and the same patient who's probably in the same degree of pain who looks a different way. And I feel like there is a difference in how those two patients are managed. And I don't think it's a purposeful, we don't want to treat Black patients' pain. I think it's the inherent biases that rule our communities right now. There's this concept or idea or notion that either Black patients can tolerate a higher level of pain, or that they don't need as much medication or support or help as a white patient. Or sometimes it's the deeper meaning behind why they're asking for pain medication. And so it's interesting that you said, your family name dropping you to help, maybe get a leg up or a different perspective on how they were treated. Because it happens to me too in my family, but not every family, like I said before, has a doctor that they can name drop, or has a friend that they know that's a doctor. Again, echoing why it's so important that we increase our numbers.
I agree. And I mean, implicit bias, it's certainly, the majority of the time, it's not intentional. It really is, a culmination of our experiences in this country, and our background and a lot of things, and I don't think it's necessarily intentional. However, I think it's very important for us to figure out a way to increase the diversity in healthcare, but also to try to train physicians and healthcare workers in a way that is truly impactful to be able to, self-reflect and understand their implicit biases and how to navigate them. What I have found is when you're in the room and talking about some of these differences, it can be very triggering for individuals. And once individuals get triggered and start taking it personally, physicians and healthcare workers don't want to be looked at as if they're doing these things on purpose. And I think they're not doing this on purpose. And we have to find a way to teach healthcare professionals to be culturally competent and to help them to understand that we're not saying that this is intentional, but we just want to make it better and make it better for everyone involved so that all of the patients get the care that they need and deserve.
Right. I don't know about you, but as you know, the last few years have been tumultuous in terms of race in this country. And I remember there was a period of weeks to months where, it wasn't a day that I didn't go without an email or a text from a non-person of color asking me what they could do to support me better or how they could be a better advocate. Almost pressing on the point of, you feel this pressure to be like the spokesperson for your race, right? And to tell them how they can fix this problem. And I don't think it's a one-person problem, but I do think that's a big step, is that we need to stop talking about race like it's not a problem, and we need to stop talking about race like we can't fix it by acknowledging the fact that there is an inherent bias in how some people perceive people of color. I think a lot of people have a hard time admitting that because, they're not a racist. They have Black friends. They have Black coworkers.
Right.
So they think that makes them an automatic advocate. But I think admitting and realizing the prejudices that you may have that you're not always conscious of is the big important step in medicine and other fields too, obviously.
I agree. It's crucial, and it takes a lot of self-reflection, and we've got to find a more constructive way, to foster this this growth. It really is personal growth.
Well, if you could say something specifically to non-persons of color in medicine about this topic, what would you say to them?
Oh. Non-persons, I would say that over the years I've read a lot of books about disparities and diversity, equity, and inclusion, implicit bias. And I would say that one of the best books I've ever read that I thought provided a good framework and some good tools for people to kind of think about themselves and reflecting on how we can make this better is a book called White Fragility. And that book was, I thought that book was very moving for me in a lot of ways. And it really described how I feel, a lot of times when people come to me, as you were saying earlier, Demi, and asked what they could do or how they could better support you and things of that nature. I think that book really, really shed light on the fact that it's not healthy for us to look to the marginalized individual to fix things or, and to do things. And that book is written by by a white woman, Robin, I can't remember, D'Angelo, I believe is her name. Robin DiAngelo. And I think that, you know, some of the things and some of the advice she gave in that book was great. Yeah, I think it was great.
Yeah. I don't think there's one good answer to give people. And I always struggled with what to say in response to people asking me, like, how I can help, how I can be a better advocate, how I can provide better support for you. Because, like you described, you know, when you were going through your residency, you felt supported. You looked around and you were the only one. But I honestly don't recall many occasions where the people I worked with, you know, made me feel inferior, different, unsupported in whatsoever by being a woman or by being Black. And, you know, and I'm not trying to say that that is not a problem. I just think we've been very fortunate to have the mentors and the training programs that we did. So when people come to me and ask that sort of question, I find like the best conversations that I've had about race with non-people of color is when they just ask specifically about a certain circumstance where, you know, they were in a room full of people and a comment was made about race, whether it was offensive, subtly so, overtly so. You know, what did you do in that moment? You know, did you go home and send an email to your Black friend and ask them what you should have done, or did you do something in that moment? Because for me, the instances that I recall of feeling uncomfortable being Black in the hospital were being in a room where something was said that made me feel some type of way, and looking around and realizing I was either the only one who felt it or nobody was going to say or do anything about it. So I think something can be said about helping us not feel like we're the only one, recognizing the injustice in the room, you know, that kind of support in the moment, not in retrospect, not questioning later on down the road if you could have done something better, but asking in that moment, you know, was this appropriate or not? Was this, you know, racist or not? Was this sexist or not? You know, hindsight can't always just be the only thing we're looking at. So
I think it's very comforting for me when individuals who are not people of color actually stand up and say something when someone makes a microaggression or racist comment. I mean, that's when I feel the most supported.
Yeah. And not feeling uncomfortable in doing so, right? I'm not saying that like you should be jumping down the throats of every single person who says something that you're not sure was offensive, but I think we have to get more comfortable bringing it up in the room, you know? That might have been offensive. Was it offensive to you? It was offensive to me. You know, that kind of dialogue, and not being afraid of what that means if you say something or speak up, either for yourself or a colleague or a friend. You know, I think we just have to, in general, be more comfortable talking about race.
I agree. We can't tiptoe around race. I mean, it can't be the elephant in the room. We have to try to have direct conversations and dialogue about it.
What would you say to Black women and girls who are doubting belief in themselves?
Oh. Well, I will tell you, I think that part of the reason that I've been able to achieve my goals is because of my mom. So my mother was an educator, and she's actually from not far from Memphis. She's from Mississippi, Tupelo, Mississippi, which is the birthplace of Elvis Presley. And she actually used to play with Elvis growing up. It's kind of funny when they were little. It's wild. But, you know, she loved kids, and she wanted to have about 15 kids. Okay. Thank God she only had 2. I don't think I could stomach more than 1 brother. But anyways, since she couldn't have kids, she was told she couldn't have kids. So she ended up having 2. She opened her own businesses, and she was a teacher. She was a Detroit public school teacher, and she opened nursery schools. And, she devoted her life to empowering youth and children. And I just remember my whole life, she used to tell me, you can do anything you want to do if you put your mind to it. And she started that. If you talk to her, she started in utero. So when I was in her womb, she used to read stories to me and tell me these powerful phrases. And growing up, I remember, when I was a little girl, you can do anything in life. It was like a broken record over and over and over. And by the time I was a teenager, I would kind of be like, yeah, I know, I can do anything. I know, Mom. But I think that, that became my lived experience. I think that she spoke those words and I believed them. Mm-hmm. And so I think it's important for all of the little young boys and girls out there to know that, you can do anything you want to do in life. You just put your mind to it and work towards it. Reach out, connect, find the right people to support you, and go for it. But, it all comes from believing in yourself first and foremost.
Right. So much of that has to come from within. I was fortunate to have a mother very similar to yours who pushed me all the time to just be the best that I could be. And not everybody, unfortunately, has that kind of role model for them readily available. But I think for myself, once I got into medicine, reading about, people I admired, seeing mentors that just inspired me, really hold on to those stories, right? Those are the people that show you that these types of things and achievements and, the legacy you're creating, it shows that it's possible. Like you were talking about during your residency, applying for this, funding that you didn't think was possible and using it to help further a cause that you really believed in. That took some belief in yourself, as well as people encouraging you to follow what you were setting to do. But I do think you have to look from within and find your inspiration somewhere. For me, it's family. For you, it sounds like it's family, but it doesn't have to be. It could be, the person on the news, the woman making strides. It can be Michelle.
That's right. Exactly. That's right.
Find your inspiration where you can and just hold on to that. I think. My mother, she grew up in housing projects in Asheville, North Carolina. For most of her schooling until high school, she was in a segregated school. And when she did go to integrated school, they divided them into two paths, the vocational route or, the more STEM, higher education route. And she was it was her brother who was initially put in the vocational route, and he protested. Until he was allowed to pursue the route of higher education. They didn't have any support. They were first-generation college students. My grandmother didn't graduate from high school. She had no idea what to do with, these children with such potential, but don't know where to go to fulfill it. And I remember my mother telling me that you can't let your surroundings define, just because everyone around you is content to stay, doesn't mean that you can't be that one person that does a different path, gets out, and then continues to pay it forward. So I guess what I would say to people who aren't always fortunate to be brought up with a bunch of positivity and support and role models, is that you kind of have to identify within yourself where you want to go and not accept where you are as what it's going to be. I don't know if that makes any sense whatsoever, but, if you don't want to be doing or be where you are, and fortunate, it's going to be a harder path for you because you don't have people pushing you up and putting you up, but it's possible. People do it every day. And it's like what you said, it takes something really powerful from within, a powerful belief in yourself and your ability to achieve what you want to achieve. So
I agree. And I echo that. And I also think that it's important to realize that your mentors, your support system doesn't necessarily have to come from your family. I think it's important for you to look beyond your family, whether it's your teacher or your high school counselor or your pastor or
your doctor,
or your doctor. That's right. They can mentors and support systems can come in many ways, shapes, and forms. And it's important for you to really, I don't know, really hone in on who really has your back and look for that person. Um, there are many organizations like Big Brother, Big Sister. There are many community Boys and Girls Club of America, many other community organizations, even sports, your sports coaches. There are many people that can serve as role models or support systems. And I think it's important to look beyond the family if you're not getting the support or, if the family is not capable of providing the support that you need.
Yeah. And to kind of tag on that, if you identify someone that you think could be that support for you, a mentor for you, and they aren't, don't be afraid to try again until it works, until you find the person that fits. Just because one person is either not interested in helping you or, you don't feel comfortable with them as your mentor, change it up. Be very assertive about your future, There's nothing that says that the first person you talk to has to be your person. And that's something I've personally felt like I've had to do over the years, finding the people who give you the right advice, who help you along in the right way, and don't be afraid to keep looking for that person.
I agree. You really have to navigate the waters. Everyone, even though you may identify someone and think they'd be the perfect mentor, they may not be the best mentor for you. And you have to make sure, it's very important that we don't take it personally. Sometimes we don't know what's going on in that mentor's lives. I mean, they may be having personal problems, they may be having marital problems, they may be very busy or overwhelmed with their burden or their clinical work or whatever they are doing in life. So it's important to not take it personally, and it's important to not let that knock you down. You got to get up and keep moving and keep looking for other mentors and support systems who are going to be there for you. But don't feel discouraged when you run into people who really aren't supporting you the way you would have envisioned.
Yeah, what you're saying is important, and I think it goes back to the point that, as women, as Black women specifically, we're kind of taught to not be a burden, to be independent. But in this instant, I think it's the time to be assertive and even borderline aggressive about advocating for yourself, and stepping out of that comfort zone where you feel like you're going to be bothering someone. Because I know I speak for you when I say this. I have several mentees, people who reach out to me who are in undergrad trying to get into med school trying to get into residency, former residents trying to figure out what they want to do. And I don't recall a time where that's ever bothered me. I love helping people just as there were people there to help me. And if for some reason, like you said, it does seem like you're bothering someone, move on to the next one, because this is kind of the time to be selfish about getting what you want. And so I do think it's important for us to demonstrate that it's okay to be assertive about it, because that's what everyone else is doing.